Well, about 1,000 nurses have converged on Halifax this week. But before you assume Nova Scotia's nursing shortage has ended, we should tell you that they are not here to deal with medical issues. They've come largely to talk politics. For the first time, the Canadian Federation of Nurses Unions is holding its biannual convention in Halifax. And with an election on the horizon, the group is determined to force some of its issues into the campaign. Joining us tonight to talk more about this is the president of the organization, Linda Silas. Thanks so much for joining us tonight. Linda, welcome back to CTV News at 6.
Thank you, Bruce.
I suspect the theme of the gathering this year gives us a real sense of what's on the agenda. The theme, we've got the power, making a difference.
Yes, and it's important for nurses to realize that they do have a voice and it's time they speak up. Within our code of ethics, we say we're patient advocates, and then we kind of back away from politics because, oh, it's the big bad P.
Sure.
Exactly. And we know what's happening in our healthcare system. We know the cutbacks from the federal government is impacting all healthcare facilities in Nova Scotia and across the country, and they need to speak up and put healthcare is the #1 priority for the next batch of federal politicians.
But isn't healthcare a priority for most Canadians already anyway?
Yes, we released a poll today, just again to tell politicians, wake up. Healthcare is the #1 issue. At over 86% of Canadians are saying it again and again. But when you look at what the Harper government has been doing is washing their hands away from healthcare. And that's dangerous because it leaves governments like in Nova Scotia and the other provinces holding the bag for healthcare. And when we started our healthcare program, our public Medicare program, it was a 50-50 funding of the program. And now we're scared it's going to go below 16%, below 12%, some predict, if the federal formula continues that way.
Dangerous level.
And dangerous level. It means layoff, cutting hospital, closing beds again, and never mind expanding where we need to.
It seems to me that nurses are kind of in an ideal position, I suppose, to lobby the political parties. I mean, first of all, you're the frontline workers that the patients deal with and see every day. Most of the patients absolutely adore nurses, that's well known. And you also make up a large percentage of the healthcare sector. So this is really going to be a powerful lobby here.
Yeah, we're over 70% of the healthcare workforce, so we're there. And the fact that we're there 24 hours, 7 days a week also makes an impact. Because
people see that,
yeah,
of course.
people will see us, and people and families. I still have patients that I dealt with in the 1990s that when I go back home in New Brunswick, that they will recognize me and talk to me. So it is a connection that you build, but it's important for us to speak out and really knock on those doors of politicians to put it a priority.
And you and I were talking just in the break there. The CFNU is actually registered, or is going to register, as a third-party advertiser. That's commonly called a lobbyist in Ottawa. So why was it important to take that step? Why was it important to formalize that?
Yeah. So as a federation, we're nonpartisan, so we won't tell our members how to vote. And we've been talking to our members about federal election, provincial elections since we were born 30 years ago. But it's the first time we feel the urge that we need to talk to the public. And to be able to give our message to the public on how the federal government needs to be leaders in our healthcare field, we have to apply for third-party advertising, and we will be doing that as soon as the writ is called for the federal election.
Does all of this boil down to money? Is this a case of just throwing more money at the healthcare system?
No, it's not really a case of money. If you look at just last July, we were all in PI at the Council of Federation, and we brought health economists to the premiers to talk about a national prescription drug program where we could save up to $11 billion a year. Imagine what that would do to Nova Scotia, what that would do to New Brunswick and the rest of the provinces. And the premiers, the ministers of health, were very interested, and we're seeing more pickup. But the federal government, no go. And that is wrong. You can't have the largest public sector and the largest public service in the country without having federal leadership. And the only way to save money, because we're still a small country, you know, there's a factoid that I'm going to introduce to our convention. The size of Canada, the population, is the same population as California.
Yeah, that's a good point.
And when you look, so we have to work together to save money. And we have to do things differently. Right now, patients go through the emergency room for everything. Why? Because they have no other place to go. That's the most expensive area. So we have to find better solutions.
And of course, the Federation is obviously very serious about this because some of the workshops this year focus on political activism and policy issues. These are things you're going to be telling your frontline nurses. These are things you need to know.
They're going to be trained, and they are also, there's no free lunch. They're getting free educations this week to be able to go back in the region and talk to their neighbors, talk to their co-workers, and really help candidates understand why healthcare is so important.
And I understand you're going to wrap it all up with a big healthcare rally. You've got that planned on Friday.
Yes, you will see more white scrubs walking the streets of Halifax on Friday at noon. And nurses, we do it with lots of energy. So lots of music, beautiful colors, and hopefully the sunshine will be with us on Friday.
We'll watch for that. Thank you for joining us, Linda.
I thank you.
Linda Silas, the president of the Canadian Federation of Nurses, holding its convention in Halifax this week with a focus on politics for the first time. Stay tuned. Lots more to come.